Analysis and treatment of schizophrenia. Schizophrenia is not only one of the most chronic and severe mental disorders that affect a person's thinking, feeling, perception, and behavior, but also a kind of reasoning and thinking collapse that occurs with the exacerbation of any type of mental disorder. Despite extensive research, the exact cause of this disease has not yet been determined, but several factors play a role in its occurrence. In this clip, I will express my opinions and experiences in the treatment of schizophrenia. The roots of schizophrenia. Any mental disorder that reaches an acute stage turns into schizophrenia. In this situation, the person loses contact with the real world, and because rationality produces ineffective and even harmful results for the person, he abandons rationality and lives mostly in the world of fantasy and dreams. Mechanism of mental collapse in schizophrenia. The thought process in schizophrenia is very similar to a disorder in the body's immune system. Just as in some autoimmune diseases, the immune system acts against the body. In schizophrenia, the person's thinking and reasoning system acts against themselves due to having a reasoning base that is the result of negative energy and negative meanings and beliefs. The person reaches conclusions that are not only not beneficial to him, but also harm him and those around him. As a result, the person suffers from a breakdown in reasoning and gradually distances himself from logic and reality. Treating schizophrenia is very difficult for this reason because any attempt to change the person's mental beliefs and meanings requires logical reasoning. While the person with schizophrenia resists any kind of reasoning due to distrust of his own and others' thinking systems. Therapeutic approach. Rebuilding trust and meaning. Therapists should not enter into a direct, rational and argumentative dialogue with the schizophrenic patient, but should first provide him with a safe and emotional space. The basis of treatment for these patients is unconditional acceptance, respect, and valuing the individual as a complete human being, without their illness defining their core identity. The most important treatment steps include the following. 1. Creating a safe and supportive environment. Meeting the individual's physical and emotional needs, treating them with respect and a deep understanding of the patient's condition. 2. Gradual trust building. Accepting the individual without judgment, establishing a sincere and stable relationship, explaining the reasons for each therapeutic action to reduce distrust. 3. Rebuilding the thought system and returning to rationality. Providing positive experiences to rebuild the meaning of life, replacing positive and constructive beliefs with negative and destructive beliefs, helping the individual find new and positive meanings in life. Schizophrenia treatment. Beyond medication. Although antipsychotic medications play an important role in reducing the symptoms of schizophrenia, they are only maintenance treatments. The ultimate goal of treatment is to achieve positive energies, beliefs, and meanings. Transforming negative energies, beliefs, and meanings into positive energies, beliefs, and meanings is the main key in the psychological treatment of schizophrenia. For example, if a person has schizophrenia and feels insecure and distrustful due to anxiety, obsession, or any other mental illness, it can be used to change these destructive feelings by eliminating the negative energy and beliefs of that mental illness and transforming them into positive ones. Over time, the patient learns that life is based on logic, rationality, and beauty, and everything that leads to valuable goals and needs of the person will be achieved through healthy and positive thinking. Conclusion: schizophrenia cannot be attributed to just one specific cause. Rather, a set of mental disorders that reach their peak intensity become schizophrenia. Treatment of this disorder requires a comprehensive, patient and emotional approach in which the patient is first placed in a safe environment, then regains trust in himself and others, and finally rebuilds his thought and meaning system. If you also have an opinion or experience in this field, I would be happy to share it with you. Also, support us by supporting the Effective Psychotherapy channel. I look forward to your valuable comments and suggestions.